TJ has been coming to DDHC for more than 15 years now. Originally, before I got into the DDHC, I would take TJ to my MD. But there are certain nuances with special needs that you don't get from a normal MD that you would get from the DDHC. Dr. Ash is a great doctor. He's the best one I've met. A lot of other doctors would just want to push the medications, where Dr. Ash is more concerned about what's best for the patient. And that's important to me because my son is everything to me.
There's nowhere else in the region that people can go to get this kind of care that our patients get at DDHC. DDHC is unique in that we're focused on treating adults with disabilities. Working at Peak Vista allows me to work with patients like TJ in a setting where I wouldn't otherwise be able to in a cohesive way, in a way that I want to practice healthcare.
Dr. Ash and I come up with a plan for how we want to proceed with TJ's care, and we keep in touch as needed throughout the weeks and months. We had to adjust medications, and we were able to get more appointments than we normally would. Normally we would see a psychiatrist every 6 months or every 12 months, but Dr. Ash took a extreme care and really wanted to see us more to make sure that we were leveling out and balancing TJ's medications. And it's hard to tell when you have someone who's nonverbal, such as TJ, how the medications are affecting him.
Something else I say very often with patients is that all behavior is communication. And so if a patient is having a behavior like TJ, it's not as easy as just saying, here's more medication, here's what we have to do. If they are having behaviors like not eating very well, is it that they're having some dental pain or some other general medical condition that we need the whole team working together on? That's not something I can do and figure out on my own. So we really work as a team.
There's one thing that's very interesting about the special needs community, at least I know with TJ for sure, is change. So having all the services in one place where he can come and see his psychiatrist and see his primary care physician, it's really wonderful. It takes a lot of stress out of his life.
The adult community of persons with intellectual disabilities is truly our most vulnerable community. We're the only primary care clinic in this region that's solely dedicated and focused on providing care to individuals with intellectual and developmental disabilities. So it's an environment where the patients can feel comfortable, the families can feel comfortable, and we're solely focused on providing that care.
I haven't had any instances where I have explained the situation and they've not been able to understand me or take an action. So it's great to have a staff that listens and actually works with you to try to give the best possible care for the individual.